Hello, this is Ryan, and I am the Medicare man. I welcome you to my website, ryancogburn.com, and I'm pleased that you came here seeking answers for all of your Medicare questions. Now, this is not common to me to make a video, so bear with me. I'll try to answer your questions, but today I just want to talk about Medicare. So Medicare falls under an umbrella, and the parts are A, B, C, and D. So Medicare Part A is hospitalization. Medicare Part B is doctoring, or what they call medical. Medicare Part C is privatization. It's a separate opt-out of the Medicare program into a private health insurance network owned and operated by one of your big health insurance companies such as Humana, Blue Cross. There's quite a few of them out there. I won't go into naming every name, but there's also Medicare Part D, which is simply the drug plan, and there are many companies under that umbrella as well. So real true Medicare is Part A and Part B, and Medicare gap policies or supplements are outside of that even, and they have plans A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. Well, it doesn't go that far, but goes to L or N or so. And what I want to emphasize to you today is the different parts of Medicare. So you probably have a pen and a piece of paper, much like I have right here. And what we're going to do is make some columns. And your first column is going to be Medicare. Just write that at the top of your sheet of paper, and then make a column for Part A. So under Part A, the next to it, you're going to write deductible, and then you're going to write cost. Very similar to what I have done right here, if you can see that on your camera. It's probably backwards, come to think of it, since it's being videoed. Everything's going to be flipped around, mirror image. But anyway, Part A. Under Part A, I want you to write hospital or hospitalization, whatever would be a better term for you. Part A is simply hospitalization, covers nothing else. There's nothing else involved in it. It does have a deductible, and that will be your next column, right? Deductible. Under Part A, I want you to write $14.08 every 60 days. So as I've done here, you'll see $14.08 every 60 days. Now the cost is going to be your next column, so write cost, and the cost for Part A is 0. However, there is a huge gap in the deductible, and that deductible is $14.08 every 60 days, so you could incur that expense several times a year. Any questions about Part A, please write them down. It's pretty simple. You don't pay for it as long as you've paid 40 quarters into Medicare, or what turns out to be 10 years. 10 years is 40 quarters, if we do the math. Paid that in, you have free Part A for life. You don't pay anything except for that deductible. Part B, however, is all of your doctoring, pretty much everything else except for drugs that has to do with health care. So under the next column, you're going to write Part B, and these columns, as you can see, I've made them all Part A, B, C, D, right down the row here. So that's going to be your next one, Part B, and under that you can write medical or doctoring, whatever you choose. It has a deductible, and that deductible annually that you'll pay, it will be $198. The cost for Part B is $144.60 per month. That is subject to change annually as well. Now, what we're going to tell you about Medicare is you want to marry your supplement, but you want to date your drug plan. So how do you do that? Well, Part D is your drug plan. It's going to change every year. Drugs are going to change every year. Companies are going to change, and the names of the plans. So you'll need to do an annual review October 15th through December 7th each and every year. And Never fails. We find somebody out there that we're going to be able to save literally thousands of dollars annually because of the review that they've done on their drug plan. So these plans will change. Make sure you're keeping up with them. You'll need a professional to help you with that. Also, and it's not optional. Part D, by the way, is not optional. You take it or you pay a heavy penalty. That penalty pay comes out to about $1 a day, or yeah, probably about an extra $30 per month that you would pay for a drug plan if you decided to opt out of Part D for several years. It would be cost prohibitive to come back in, depending on how many drugs you're on, I suppose. But nevertheless, Part C is private health insurance, and it's also known as Medicare Advantage. So Medicare Advantage is Medicare Part C. This is going to opt you out of A and B and assign you into C, where you will be covered for everything by a private health insurance company, such as Humana or Blue Cross, or just about every company I think out there. Mutual has a United Healthcare has Advantage plans. There are many, many, many different types of Advantage plans. I have one client that's on an Advantage plan that is exclusive to his area. He pays $125 a month. He has to stay in network in that area, and he has a $3,400 deductible every year. He has additional charges should he go out of network. So be careful with these things. Remember, Medicare with a gap policy is for sure the best way to go, and would have been the best option for him because he is limited and restricted in coverage and has deductibles for and pays more money than he would have on just a regular gap plan. So be careful with all of that. Doesn't matter which way you go on this, you will always pay the $144.60 a month for Part B, whether you're on an Advantage plan or not. So keep that in mind. You could be on a gap policy for $40 or $50 a month and has a smaller deductible than what this man is paying, and he would have coverage everywhere that he would go. Also, Part D has different deductibles, a lot of different companies, generally speaking. Part D deductible is $435, but you can have a zero deductible on your drug plan. Just depends. You need to have a professional crunch those numbers for you. They can use the software to do a search and find the best drug plan for you in your area, and probably the most convenient. Some people are particular as to who they do business with. Maybe there's a particular business or drug provider that you don't want to, you just don't want to go there. And so you can have your agent opt you out of that particular provider, however you want to do things. So I'm going to keep this video short, and I'm going to tell you those are the costs and those are the plans. This video is generated so that you'll hopefully call and ask some questions about Medicare. Let's keep it simple. It's really just A, B, C, and D. Everything else is going to fall under one of those umbrellas if it's Medicare. Medicare is not Medicaid. Medicaid is a program that you would qualify for financially, and you need to be very poor or very sick in order to get Medicaid. So keep that in mind. For general purposes, most of us will be on Medicare. It is, in my opinion, the very best health insurance that you can get as long as you do it right with the right gap plan. And there are differences in companies out there, so seek out a professional agent that you trust. Ask your questions. Make sure you know what you're getting and not getting, and trust that advice for your long-term care not long-term care, that would be something else, but for your long-term health care, I should say. And for your gap plan, by all means, know what you're doing with all of that and trust the advice of the professionals. The problem is there are a lot of people in this space, and so you may get a rookie agent that's not willing to tell you that they're brand new at it, and they could give you bad advice. There's a lot of bad advice out there, I can guarantee you that. What I'm trying to do is explain to you in a 10-minute video that Medicare is A, B, C, and D. Everything else is under that umbrella. Please call the number and ask me your questions or shoot me an email. Thank you.